Good morning, everybody. It's Stacy again. Hello. We are going to talk a little bit today about autism spectrum disorder and attention deficit hyperactivity disorder, ADHD. So I, as normal, I'm going to share my screen because I know it's super important that we talk about this a little bit because sometimes the way we look at a kid can be different depending on their regulatory skills and how we can figure out how to help them in the best way possible. Understanding a little bit of the neurobiology also is really helpful. Let me just pull up my slideshow a little bit. All right. I do have some videos for us to watch. So we'll be sort of talking a little bit about that. So just an overview of autism spectrum disorder, that it is 4 disorders pulled into one now. So now we call it ASD. It's a spectrum, which means that there's lots of variability. So we have autism, Asperger's, childhood disintegrative disorder, and pervasive developmental disorder, otherwise not specified. These are sort of the 4 diagnoses that have been put into this umbrella. So a little bit of info about autism is it's a developmental disorder, which we know, and it happens to start to show around the age of 3. So it can affect a child's brain development, which then leads to trouble with social functioning, interactions with others, and communication. We don't really understand what causes autism yet, and so there seems to be certain groups of people it's kind of hard to put our finger on still. So who is at risk is always kind of what we want to know. Although we don't know what causes it. We've there's a lot of research that's starting to come out from exactly, what is the cause. So we know that family history, so they think that there's a genetic component. However, family history of ASD can increase the risk, but it doesn't necessarily mean that just because somebody in your family is autistic that you will be autistic. Autism, it tends to run in families. So parents who have one autistic child have a 1 in 20 or a 5% chance of having another child with autism. So as I said, who sort of gets it? It does affect more boys than girls, and boys are 4 to 5 times more likely. It doesn't discriminate, and it strikes all groups. So it's prevalent in all racial and ethnic groups. And we have also found that lifestyle, education, and income, it doesn't pick a certain aggregate. So what this basically means is we need to do a lot more research, figure out what the cause is, who's at risk for it, and whether or not how it can be prevented or if we want to prevent it. So I have a video that I'll go ahead and show you, and all of these videos are from a DSM-5 case study. So I will go ahead and play this, and you can go ahead and read on this side sort of what some of the cues look like.
I yelled in class after Ryan Fields scooted his desk next to me, which he was not supposed to do, and touched my foot with his, which he was not supposed to do, and he's whispered something bad in my ear, which he was not supposed to do, and I've told him that he was not supposed to do that, and he knew that he wasn't supposed to do that, so he did something wrong.
Be sure to visit symptommedia.com.
So there's a lot of different sort of outward aspects that you can see, but just because somebody has all these outward aspects doesn't mean that they're necessarily a person with autism. So some common lagging skills that we find, it goes a little bit back to our collaborative problem solving trainings that we've done and talking about sort of what are areas of skill to increase. So some common interventions that can happen If you are working with a child with autism, obviously every kid is an individual. What might work for one child might not work for another. And so I kind of want to go a little bit more now into ADHD. Now, this is not like a comprehensive dive into pathophysiology and etiology of the disease and exactly the details of neurobiology behind all of this. It's a very broad overview. And so at the end of this presentation, there are some more resources you can go look at to do a little bit more from peer-reviewed literature. But this is sort of just like a small overview to understand. So here we go with ADHD.
What most people know, or think they know, about attention deficit disorder, or ADD, is that it's used to describe someone who can't stay focused, and when they really can't focus, they have attention deficit hyperactivity disorder, or ADHD. This continuum from one to the next isn't quite how it works, though. ADD and ADHD are actually synonymous, as in they're the same. ADD is an outdated term used prior to 1987, after which it evolved into ADHD to encompass more of the symptoms that people with ADHD often experience, which, in addition to being inattentive, includes both hyperactivity and impulsiveness. So, somebody might be diagnosed with ADHD because they have symptoms related to not being able to pay attention, but they might also be diagnosed with ADHD if they have symptoms related to being overly active and impulsive. They might also have ADHD if they have symptoms of both. According to the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, the most recent update being in 2013, ADHD is split into 3 subtypes: inattentive, hyperactive impulsive, or both. Inattentive and hyperactive impulsive have a set of 9 symptoms each. For example, someone with the inattentive subtype might make careless mistakes, or not listen, or be easily distracted. And someone with a hyperactivity and impulsive subtype might fidget, or squirm around, or get up from their chair often. Now, you might be thinking that everyone fidgets now and then, right? Well, a diagnosis is given when someone has 6 of the 9 symptoms for either subtype for at least 6 months. Most commonly, though, children have symptoms of both subtypes, and therefore have the combined subtype. Since ADHD is considered a neurodevelopmental disorder, the symptoms also have to have started between age 6 and 12, and the behavior can't be appropriate for their age. Alright, but what causes someone to be hyperactive, or impulsive, or inattentive? Well, as you might guess, it's pretty complicated, and we don't really know. Probably a lot of different factors, and ultimately they all fall into some combination of environmental and genetic factors. One interesting clue to a genetic component of ADHD is looking at families. For example, a child with a sibling that's been diagnosed with ADHD is more likely to develop it themselves. Furthermore, if those siblings are identical twins, meaning they have the same DNA, their chances of developing ADHD is considerably higher. Having identical DNA doesn't mean that the twin is definitely going to develop ADHD, though, which again suggests that both genetic factors and environmental factors play a part. As to a specific gene, it's probably not one single gene that leads to ADHD, but rather multiple genes that determines how severe their symptoms are. These genes likely influence the production or regulation of the brain's neurotransmitters, which are signaling molecules in the brain that are released by one neuron and received by receptors of another neuron. This movement of a neurotransmitter from neuron A to neuron B is basically a message being relayed. It's like the neurons are talking. Dopamine is a specific neurotransmitter that gets released when the brain's involved with behaviors like getting a reward, taking a risk, and being impulsive. Norepinephrine is another neurotransmitter involved in attention and arousal. It's thought that lower amounts of these two neurotransmitters floating around contributes to symptoms of ADHD. The reason why these neurotransmitters might be down in the first place is still not well understood, and research remains ongoing. Now, treatment for ADHD can be tricky since symptoms might vary from patient to patient, although it most often involves either behavioral psychotherapy, medication, or both. Behavioral psychotherapy is often targeted at children and focuses on teaching the child better time management and organizational skills. For example, having structured routines that they can follow, and then giving rewards when they stick to those routines. Also, involving both parents and teachers are important, and both behavioral parent training and behavioral classroom management have been shown to be helpful for children with ADHD. For adults, behavioral psychotherapy might focus on ways of decreasing distractions and also improving organizational skills. If medications are prescribed, typically the first line options are stimulants. Since it's thought that low levels of neurotransmitters are involved in ADHD, stimulants are used because they tend to increase the number of neurotransmitters, like dopamine, between neurons, therefore reducing symptoms. Common and well-known ADHD medications are molecules that are chemically similar to illicit stimulants like methamphetamine, but there are some key differences to keep in mind here. All of these chemicals help to increase the release of dopamine from neuron A, but the ADHD medications typically cause a slow release of dopamine, whereas illicit stimulants like methamphetamine cause a really fast release of dopamine. In fact, it's this incredible surge of dopamine that disrupts normal communication between neurons and produces euphoria, and is the reason that illicit substances like methamphetamine are highly addictive. In contrast, the slow and controlled release of dopamine caused by ADHD medications is key and helps a lot of patients improve their focus and their attention. Thanks for watching. You can help support us by donating on Patreon or
Osmosis is a great site for anything like that. They have really great, simple videos that are pretty easy to follow. So let's talk a little bit about some lagging skills that are associated with ADHD. You can see some of them there. As I said, you can always refer back to that collaborative problem solving lagging skill sheet and sort of see where these lagging skills fall. So it's also important to know that based on your biological sex that you can have different symptoms depending also on which type you have. So those that are assigned female at birth are less likely to show high-risk behaviors, dysphoria, organizational struggles. And those that are assigned male at birth have more trouble with routines and are more likely to show high-risk behaviors. I absolutely want to say that this isn't true for every single person. There can always be overlap, and everybody should be treated as an individual. So I wanted to show you a little video that I thought was really kind of interesting to watch, just to see if you can tell the difference. It's kind of interesting because this is usually the population of kids that we work with. So it's nice to have a child reference.
How old are you?
6.5. 6.
And what grade are you in?
First grade. First grade?
Do you like school?
Yeah.
Why do you like school?
Because I like to play with my friends at recess.
Why don't you like school?
Because I have to do a lot of stuff and my little sister's really cute and I want to spend more time with my little sister.
How long does it take you to do your homework? A long time or a short time?
Usually 5 or 10 minutes. I don't know, sort of in the middle.
Do you have a hard time with your homework?
Sometimes.
How do you do on tests?
Good. Well, I usually get A's but not A pluses, so I don't know. And I almost get every single one right.
Well, aren't you still proud of yourself for getting A's?
I don't know, I just feel normal.
You just feel normal, you don't feel proud of yourself?
No, I just feel normal.
Okay. Do you have a lot of friends?
Yeah. No.
How do you feel about having a lot of friends?
Happy.
How do you feel about not having a lot of friends?
Lonely.
Do you get invited to parties?
Yeah. Not usually.
Do you ever get bullied?
No. Sometimes.
Do you think you are smart?
Yeah. I don't know.
Do you think you are handsome?
Yeah.
Do you think you are pretty?
Sometimes.
What do you like about yourself?
How smart I am and how good I draw. I like myself because I like Jesus and God, and they're really important.
Is there anything that you dislike about yourself?
Nope. Sometimes I be bad.
How do you be bad?
By giving attitude to my mom.
Why do you think you give attitude?
I don't know. Sometimes I just get into moods. It depends on how good the day is. When I have a bad day, then I get all grumpy and negative. And when I have a good day, then I get all positive and happy.
What do you want other kids like your age to know that don't have ADHD? What do you want them to know about the kids that do have ADHD?
That they are better at listening than them, and that they and that they could help them.
And how can they help the kids with ADHD?
By telling them that whatever you do, it's still right because you tried your best.
So the American Psychological Association says that it affects about 5% children ages 4 to 17. And it's also a comorbid condition. So that means that they often have something else going on as well. Just a couple more facts that they have put on here is that children can have low self-esteem, sometimes they're bullied, and that, that children with ADHD also have really wonderful qualities, which is what I want us to focus on. Anyways, that's kind of that video. I think it does a really good job of summing some stuff up. So some interventions, using that collaborative problem solving and going back to that skill of being able to talk it out and work with others. Fidgets when you're being able to talk, and some movement breaks. If you would like to look more into this, this is the website that I have been learning a lot from, and I want to share it with you. And then this is just a little bit about where some of the resources that I use for this presentation are. Go ahead, stop and share my screen. So I hope that you found this helpful and that you maybe learned one thing that you didn't know before. It's just kind of important to know a little bit about what we're working with, since it is so predominant in our line of work, and to know that we can teach these skills and we can all do this together. Thank you.